Hello everyone. This is Nick Situni from Next Gen Daycare with, again, Samantha Walton, the center director here. And again, information for you. Today, we're going to be talking about
the developmental milestones of children between the ages of 18 and 36 months.
There you go. So, you might be wondering, what are those developmental milestones? I heard that children develop in their own pace, in their own accord. And I think we can agree that overall, right, Sam, this is what really happens. But, researchers, I was a researcher myself, we try to create barriers, boundaries, if you may, in this case, milestones, to find some sort of standard, something that is often repeated and can be standardized. So, Sam, let's talk about the categories. So, what are the categories of those milestones?
So the developmental milestones are broken up into 5 categories. There's gross motor, fine motor, language, cognitive, and social and emotional behavior, which can also do into self.
Beautiful. And again, just so you folks there have a little bit of an understanding, regardless of all of that, kids overall, they will be developing all those skills pretty much at the same time, right? And some of them will have more skills in one than the others. It's normal for kids to, even they are the same age, to be better or a little worse than others depending on their own genetic makeup and what they're exposed to, right? And those are things that we don't have a lot of control. Now, Sam, this is a little bit of a tricky question, and but I want to put you on the spot for that. From all of those, do you think there is any of those milestones that are more important than others, and why?
Well, for the most part, I don't believe that there are any that are more important than others, but I do believe that each of them will have a signifying point for your child to show that they're hitting the right stages of development.
There you go.
So for gross motor, that's usually a lot of movement, big heavy movements, so running or jumping. Fine motor skills are for drawing or cutting, using hands mostly. Language, being able to speak and have different languages as well. Cognitive is about the ability to start thinking a little bit ahead, learning how to do things at a certain pace. And social and emotional behavior, it comes down to interactions more than anything. And then with that is also self, so them learning how to do things for themselves without a parent or caregiver's help.
There you go. So, nice thing about that, and my favorite, not the most important, but my favorite, it'll be a little bit of the social emotional behavior. And as a justification, again, I come from a country different than Canada. I'm from Brazil, and we are very early in life pushed to become social, and of course we go through a lot of motions that allows us to be more social than, for example, the counterparts here in Canada. So it really warms my heart when I see a child that is well developed in the social emotional behavior. But as Sam said, a holistic approach to that means that children should be developing all of those kind of concomitantly together, with understanding that, of course, they're going to have differences amongst each other, even peers, even siblings.
Yeah.
Great. So tell us more, Sam. So what would be like the age milestones for those?
So milestones really do start from birth to up, but because we're in a daycare setting, we'll just kind of talk about the milestones that you'll see from your child from 18 to 36 months. So some of these milestones you will unfortunately miss because you will be at work and we are the ones that get to see those happen.
Sorry.
But we do notice those things, and we do want parents to keep informed so that they know where their child is hitting and what points they might need help. For the most part, really, like Nick is saying, children will develop at their own pace, but there is about an age bracket where certain things should be happening, and that's when parents should take notice if they haven't quite started yet. So for 18 to 24 months, most toddlers will use 2 to 4 words in their sentence. So for us, it's a sentence that's not very long, but if they can respond to you using 2 to 4 words, they're right where they need to be. They like to walk alone, so they've now gained independence for self, and that's also a gross motor thing as well, because they want to move in big steps now. Another fine gross motor activity that toddlers will really like to do is to take things apart. We know how much fun that is, and we also know how much they don't like to put things back together. That will happen. That part of the developmental milestones will hit soon, just not yet.
But then that's when we need to be careful, and for all parents out there, for putting good boundaries where the cleanup time needs to happen. Right? I don't have kids yet, as you know, Sam, but I'm assuming that once I will, I might be one of those people who just like, oh, child, you broke the whole house apart. It's fine. Daddy will build another one. So I need to start creating those boundaries within myself here. Now, one important thing, jokes apart with all of that, Sam, is I really want to bring here the idea of the differences between children, between siblings, and how they're even exposed to. And something for all parents out there to be mindful of, especially if you have siblings that are developing in different rates, is that there is no right or wrong. There is need, correct me if I'm wrong, for a little bit of a push. So parents should allow children to be in their comfort zone, but at the same time allowing them to understand that there is a challenge to be accomplished.
Yes.
Right? So we don't need to be rascals, just, like yelling at their children, why you don't use a 2 to 4 sentence long phrase. But it might be a very good idea to give a little bit of a stimulation, like a little bit of a push. Like, hey, do you know another phrase? Do you know another word? Right? So children can also understand how that's important to you as a parent and to them, so they can get their independence, right?
That's right. And that's usually what it will come down to is then your child will notice that you do things for them. As a parent and as a caregiver, we have to know the time to step back and not so much do things for them, but be able to encourage them to start doing things on their own. So one of those things could easily be putting on shoes. We know that that can be time tasking as trying to do it yourself as a parent or as a caregiver. And once a child is able to learn how to put on their shoes, it does take away a lot of the time of getting ready, and it gives them a really high confidence boost in knowing that they did it themselves.
Perfect. Let's go to the next age window then.
Okay, so we'll do right now from 24 to 36 months. So with 24 to 36 months, they're usually using 3 sentences. So it might still just involve a few words at a time, so 2 to 4, but they're now stopping and restarting to explain something else to you. So they've stopped a sentence and now they're starting to do more with it. Let's see here. So at this point, they should be able to run easily. As much as they may look like Bambi, they're still able to run. Some children, again, like Nick is saying, and like I totally agree with, it might look different for each child, and it might look a little different depending on what their skill set is. But by this point, at the 24 to 36 months, they should want to run and attempt to do it on their own. If you're drawing with them, a good shape to use that is very simple so that they can learn how to copy it is a circle. It's very simple and it's a nice one, and you can turn that into a sun and a smiley face, many other things as well. So again, putting on their own shoes, that's a really good sense of self and autonomy within that, and it gives you a little bit of a break because now they can do those things on their own. Another thing that children will start to do is to show empathy. So that's a big social and emotional one, because then they're not just taking into account how they feel and what they want to have happen. They are now looking to their peers or their friends to see how they should be acting, and they're now able to, if their friend is sad, they're able to say so-and-so is sad, or happy, or angry.
There's a lot of research, of course, in the childcare world overall, and even for children development. And it's super funny how there is a heavy positive relationship between how empathetic parents can be and how empathetic their children will not only start a little earlier, but how they will be showing that empathy better. And it's a funny phrase that I like to say because it applies for pretty much all humankind, as monkey see, monkey does, right? It's the same thing with children. If a child notices that you as a parent is showing empathy, is getting concerned, is trying to understand what the others are doing, they will start copying you because you are the most important reference that the child has in the world. So if you want to influence that part of empathy, again, just as a parent, try to show as much empathy as clearly as you can so your child can follow up with that, right?
Yeah, engaging with their day, engaging with how they, handle the situation, or whether it be a temper tantrum, being very sad. If you're always exaggerating like how you feel about them when they're doing those things, like if they come to you because they see that you're sad and they want to give you a hug, you let them and you tell them that they are doing the right thing and you support them in that. If they see a friend that's upset and they're trying to ask them, you still support them in trying to do those things, but then we come to a point of trying to recognize when is a good time for the other child as well. But
Cool.
It's still important to encourage the empathy.
Perfect. And just to wrap up as usual with a quick summary, most important take-home message here, yes, there are milestones, lots of research done in it. Those milestones are usually revolving in those skills, gross motor, fine motor, language, cognitive, and social-emotional, right? It is normal for children to have even be super good at one of them. It is normal for siblings to have different levels of mastership in those things. And of course, if you for some reason believe that like, oh my god, my child might have some problem, it doesn't hurt just to take the child to a doctor, a therapist, a medical professional that has some level of specialty in children, just to cross your T's and dot your I's. But with our experience here, what we see is unless the case seems to be extreme, eventually children will develop in one way or another. And if you believe that the health professional will have a little bit of more of a push than you to maybe give that challenge to your children, my answer is why not? Right?
Exactly.
So that's it for today, folks. Thank you very much for watching us so far. Stay tuned for more very informational videos about childcare. See you in the next video.